All of us love to think about, and we wait anxiously for healthy babies to be born into our families and communities. We love their soft, wrinkly skin, that sweet baby smell, their straight, curly, or kinky hair, their colors reflecting the tones in the finest contemporary landscape. We adore their coos. We feel helpless when they cry. We make plans for them before they arrive. School, college, careers, marriage, children, and the circle of life goes on. But far too many of us find ourselves having to dream another dream. Families like the McQuillers.
Thursday, Friday, and then Saturday, it was just like the worst day of our life. I went to the crib and to see your child not breathing and knowing that I was there all by myself and knowing that he had went to work, I didn't know what to do. I called 911, they came. I called my mom, I called him. It was just like a very overwhelming situation to where it's like I went and wished that on my worst enemy for them to go through what I went through that morning and to know that it was like my whole world had ended and everybody's like, oh, you're gonna be okay, you can have more kids. Even though we brought 3 more girls into this world after her and we're about to have her son, it's like that empty space has never felt. I mean, every year we celebrate her birthday. Every year I go to myself, you know, for her death, and it's just like, I never just like experienced something like this, and it was just, I don't know.
Hard feeling. I mean, even though, you know, we had other children, like she said, it's just that empty void. You know, it's something you never forget. It's a day I'll never forget. Even though as much as I try to block it out, I don't remember the exact day to the date, but it's something that you know. And now, after losing that child, when we brought home our other girls, you know, it's more. You stay up all night watching your children and stuff because, you know, you never know when the last time, you know, I never got a chance to say goodbye. I never got a chance to give her that last kiss, that last hug. And it hurts to this day, you know. So just, you know, you try to enjoy every moment that you have, especially with the girls that I have now. You know, I try to kiss them. I love them. Give them hugs, show them that Daddy is always there. But, you know, Harmony is always there in my heart, no matter what. Sometimes I even get confused and call some of my other kids Harmony, just because she's always on my mind, you know, and it's a horrible thing. It's something you never truly get over. Even though you try to shade it, you try to put it in the past, it's something you never, and you know people are supposed to die. Eventually everybody is going to go, but you're not supposed to bury your kids, you know. Your kids are supposed to bury you.
Thank you so much to the McQuiller family for sharing your story with us. You are a symbol of strength, and it is because of families like you that we are here today. I'm Deborah Austin, Director of Community Engagement for Reach Up Incorporated. For more than 20 years, I've been privileged to help involve community members in problem-solving solutions to issues that affect us all. Unfortunately, the experience of the McQuiller family is not unique. Far too many babies die before their first birthday. When a baby dies before his or her first birthday, we refer to that as infant mortality. And the infant mortality rate is the number of infant deaths for every 1,000 live births annually. Our community and communities across the nation use what we call fetal and infant mortality review projects to address fetal and infant deaths. The overall goal of a fetal and infant mortality review, or Fema project, is to enhance the health and well-being of women, infants, and families by improving the community resources and service delivery systems available to them. The Fema process looks something like this. First, a fetal or infant death occurs. Next, cases are selected and information about the case is reviewed by looking at the clinical records. In some cases, the mother, father, and family of the baby are interviewed. Then, the case review team reviews the case and makes recommendations about what might have prevented this death to a community action team. The community action team translates the recommendations of the community review team into action and participates in implementing changes designed to keep more of our babies alive to celebrate their first birthday. Now you'll hear from Dr. Lisa Stanley, the Associate Executive Director of the Healthy Start Coalition of Hillsborough County and our local Fema Project Director.
Our Hillsborough County Fimr project has been operational since 2003. Fimr enables the community to understand the circumstances that surround a fetal or infant death, to understand the system issues at the community level that might have contributed to that death, so that we can develop community-level interventions and implement those interventions. We select our cases using the Perinatal Periods of Risk framework. This framework helps us to see where our fetal and infant mortality is occurring based on the age and birth weight. We select those cases where we have the highest rates and where we have the greatest disparities. We abstract death certificates from the Office of Vital Records, and we are fortunate to have such a supportive relationship with the Hillsborough County Health Department in this process. My two nurse abstractors will abstract all the prenatal records and all the relevant medical records at the hospital. We will also gather information from any programs that this family might have been involved with, such as Healthy Start or Healthy Families. And we also receive a summary of the autopsy if one was performed. We have 2 mental health counselors who attempt to do the maternal interviews. This information is all de-identified prior to presenting it to the committee. Now, in order to analyze our infant mortality in Hillsborough County, I look at the vital statistics data. And this will give me a context that I can put the findings from our Fema reviews in. First, I analyze the rates to determine our trends, cause-specific mortality rates, and birth weight-specific mortality rates. Then I can compare our Fema cases with this data to determine if we have bias in our reviews. I also look at the risk factors on the birth certificate and the Pregnancy Risk Assessment Monitoring System, or PRAMS. PRAMS is a survey of women who have given birth in the previous year. We look at this to determine if the risk factors in our Fema case reviews are different from those in the general population to guide the development of our interventions. Hillsborough County has implemented a number of interventions due to our Fema project. I want to mention 3. Our Safe Baby campaign, which is focused on reducing deaths due to sudden infant death syndrome, suffocation due to co-sleeping, and abusive head trauma. Our interconception care work works to improve the mother's health prior to her next pregnancy and reduce deaths due to prematurity. And our staff in the neonatal intensive care units address both infant health and safety and the mother's health between pregnancies. Now we will hear from Dr. Troutman, USF Professor, Associate Dean for Health Equity and Community Engagement.
There are many measures that are used around the world to define the overall health status of the population and how caring the government is about the lives of its people and its citizens. One of the things that's very important in terms of that measure is infant mortality. It is recognized around the globe as the primary indicator of the focus of the government on the health of its people. Unfortunately, in this country, we have a condition where there's a disparity or an inequity between the health status of whites and blacks and other groups, other minority groups. In fact, infant mortality in the United States, when you look at African Americans and whites in a comparison, are as much as 2 to 3 to 4 times greater than they are for whites. This is a situation that's existed for quite some time. The health disparities or inequities have existed in this country for centuries, literally for centuries. You can trace it all the way back to the slave era, beyond up to the present day. And health disparities as a focus is now beginning to gain attention. That is to say that why is it that we have differences in population based upon race, ethnicity, socioeconomic status, etc.? Why is it that babies die 2 to 3 to 4 times higher in the black community than they do in the white community? one of the vehicles that's being used is infant mortality review committees around the country, which is to say that people come together to investigate the death of any child in particular, but those in that early term, neonatal first 28 days or first year in particular, why is it that they died? And the infant mortality review is an opportunity for community groups to come together, work together, and try to figure out what the issues are that they might be able to correct by policy, practice, or just a different focus or resources to deal with some of these issues. For instance, we know that a baby who dies in the first 28 days is probably reacting to something that its mother did during prenatal care.
I became involved in the Fema process over 20 years ago. In Hillsborough County, Fema became active for a brief period of time between 1994 and 1996, but for a various number of reasons we were unable to continue that program until we began the program again in 2003, and it has been continued since that time. I became involved as the original chairman of the Fimr committee in Hillsborough County, and the reason I did that was at the time that the committee formulated, I was very active in quality and safety aspects at various hospitals here in Tampa having to do with childbirth. And as a natural result of that, Fimr gave me a great opportunity to broaden our reviews outside of the traditional hospital type of reviews. The advantage of Fimr is that we bring together so many community resources that in independent reviews that physicians, doctors and nurses are used to doing in hospitals, we're restricted by the fact that we don't have the big picture oftentimes. When a baby dies during pregnancy or after delivery, we have the hospital take, we have the hospital review. We don't know what happened in the community. We don't know about that patient, that family, and what was happening prior to that hospitalization. We don't know the agencies that are involved and what they do or could have done or not do in these services. If we did reviews and we did them well and we implemented projects that were based on deficiencies we find in healthcare and community support for these patients, that it would make a difference for my patients. It would make the difference for me as a physician, and that I would apply those changes to my practice. One thing that is very important for anyone considering Fimr activities is to understand that the whole process is done in an extremely confidential manner. There are no privacy issues. Everything is de-identified completely. When the cases are discussed, no names are mentioned, no hospitals are mentioned, no doctors are mentioned, no patients are mentioned. It's all extremely confidential in every aspect of the review. The Fetal Infant Mortality Review provides a tremendous opportunity for community collaboration in understanding how a wide array of clinical, social, economic, health, educational, environmental, and safety issues relate to the infant loss on a local level. In turn, that information can be utilized to improve community resources and systems of care to address the ultimate goal of improving infant mortality rates and the overall health of pregnant women, infants, and non-pregnant women of reproductive age. To learn more about Fimr and about how it can help your community, please contact the Hillsborough County Fimr Project at 813-233-2800.